Part 2 of Myths and Misconceptions about Art Therapy. Art therapy is a replacement for talk therapy. Well, not so much either, because I'm going to talk to you during our session. I do have a dual major in clinical mental health and art therapy, so I have training in both of those backgrounds, so I am going to incorporate talking. But here's what, if you're working with a therapist, a talk therapist, about issues that maybe I'm not going to dive into, that actually could be maybe medically backed, things like that, that is important that you keep that therapist. I'm just going to bring other pieces into it. So it's kind of like an accessory too, but also not going to interrupt what that other therapist is doing with you. In fact, maybe we would actually collaborate and figure out what would be the best approach working with you as a patient or client. Another misconception is that art therapy is unstructured and chaotic. Actually, it isn't. I mean, every therapist is different. I definitely have a layout when I have a session and know what I come into the session doing, what that midway point is, and what does it look like wrapping up. It's not chaotic. It could be chaotic if there's art supplies all over, but for me, that's not usually how it goes. So that is another misconception, and I hope that goes out the window. Another misconception and myth is that art therapy is only for people with mental illness. Okay, so you don't need a diagnosis to come to me. Basically, it's any challenge you are facing. It could be an issue that maybe you're an empty nester, maybe you're dealing with being alone for the first time in your life after your kids have left the nest. There are certain things, but that's not technically a mental illness. So art therapy covers such a wide range of things that it will help you with, from stress to some of those mental illnesses, but there's no formal diagnosis needed. And lastly, art therapy is just for expressing your feelings. No, it is not about that. Sure, it is a big part of it is being able to express yourself through artistic means, but it is not what it is solely about. Art therapy can be used for self-growth, self-exploration, for focus, for stress reduction. So there's so many different areas that it can cover. So it is not strictly about expressing your feelings. There may be sessions where you come in and we actually don't really dig too deep, but we're actually just finding coping mechanisms. Okay, so that's a little bit different. So that's the last misconception and myth that I have for you. Thank you so much for tuning in. I'm Jean, and I'm an art therapist.